Hi, welcome. This is a little bit of a new experience for me, giving a lecture over the internet, but we'll see how we go with things today. As Ali said, my name's Sam Hall. I'm an accredited exercise physiologist at Aspire Fitness Rehabilitation, and starting from February this year, our gym rehab facility has been involved in a pilot program with the Leukaemia Foundation, and what we've been going through is taking patients from the Leukaemia Foundation at different stages of their treatment pathway and putting them through a 12-week rehabilitation program. And what I've got today is just to show you some of the benefits that we've been seeing from those first 24 people. We've now got up to, I think, around 60 people through this year. We've got data for the first 24, which is really quite exciting. And the great thing about this program is that it's been so successful that we've now got the go-ahead to keep it going for 3 years. And not just in Brisbane, we're looking at potentially the Gold Coast, Townsville and Cairns for next year. But we'll just go through. So let's go. All right. So a little bit about us. We are located in Woolloongabba in Brisbane. We've previously done some medical-based rehab programs with Alzheimer's and chronic disease education groups. We've had close ties with the Cancer Council of Queensland, University of Queensland, and cancer support groups throughout Queensland. So we've had a little bit of time with medical-based rehab. The centre was really set up as an extension of the Queensland Sports Medicine Centre, as a facility to service the community for medical-based rehab and also end-stage return to function rehab, so things like post-surgical hips, knees and shoulders. And as far as we know, we're one of the only dedicated rehab facilities in Brisbane offering these types of services. As we said before, we're accredited exercise physiologists, so we've got to go through 4 years worth of study across a wide range of different disease states. So we are primarily looking at strength and conditioning. We are also looking at cardiovascular pathologies, so things like heart attacks, also metabolic diseases such as diabetes, and then also cancers. So we'll go through. I think the best way to go through is, and the way I went through a lot of my university, is I went to YouTube to find a lot of things if I didn't understand a lot of things. So I've got a great clip here which pretty well sums up most of the key points on why exercise is actually beneficial for someone like yourself who may be going through cancer treatment. It may seem a little bit counterintuitive to think about exercise when you're going through something like chemotherapy or radiotherapy or a bone marrow transplant. However, I think through the course of this talk, hopefully we can educate you on the types of things we're saying when we say exercise, and also the great benefits that there is to have from integrating some exercise into your lifestyle. So I'll hand this over to Dr. Mike Evans, who's a really great researcher in the United States, who's done a few of these little videos which you can find on YouTube. This one is particularly important for us because it deals with cancer-related fatigue. So I'll hand it over to Dr. Mike Evans.
Hi, I'm Dr. Mike Evans, and I have a quiz for you. I want you to guess what the most common medical issue is for people on the cancer journey. Maybe pain, or depression, anxiety, lost appetite? Turns out the biggest complaint in people with cancer is fatigue, tiredness, exhaustion. It is important for you and the other people in your life to know that fatigue in cancer is partly normal fatigue. the fatigue you had before you had cancer, getting tired, coping with specific health problems, and so on. Then layered on top for the majority of people with cancer, but not all, is a fatigue that is different, that we don't totally understand, but it seems to come with the things that come with cancer: harsh treatments, stress, travel, the cancer itself. A fatigue that is different than normal fatigue, as it tends to last longer and is not relieved by rest and a good night's sleep. As one of my patients said, "My brain says go, my body says no." Fatigue and cancer are two words with a lot of meanings. We humans have many different types of cancer. We will all have variable outcomes, severities, treatments, so it's very difficult to generalize, and there's not a one-size-fits-all strategy here. Having said that, I think there's a massive opportunity to make progress on a pervasive symptom that you and I too often take for granted. Fatigue, like pain, is a self-perceived state. Patients often describe it as a sensation of exhaustion during or after usual activities, or even a feeling of inadequate energy to actually begin these activities. With cancer, people often refer to a new type of fatigue that is a whole-body experience. This is why it's so important we pay attention to fatigue. Our energy level permeates so many different aspects of our lives. Our mood, our work performance, how we socialize, our sense of self-confidence. So to put a positive spin on this, I think taking care of your fatigue can actually treat many other important aspects of your life. A trial led by Karl Reif and his colleagues, published in 2012, is a good example. 261 German patients with 29 different types of cancer were divided into two similar groups. Most of these patients had a high symptom burden: exhaustion, anxiety, pain, and so on, and many had already tried something to alleviate their fatigue. All participants received a general lecture about cancer-related fatigue, and then one group were put on a waiting list. The other half divided into groups and met once a week for 6 weeks. The investigators felt that just knowing what to do wasn't enough, so they focused on helping the patients improve their skills in positive change, what we call self-efficacy. In the sessions, there was lots of discussion between patients, and participants were encouraged to keep a diary to reflect on the experience, exercise, and make lifestyle changes. When they compared the waiting list group to the group that met and discussed their experiences, they found the latter group exercised more and felt more confident about making good things happen. This translated into significantly less fatigue, the main focus of the trial, but also less depression, anxiety, and increased quality of life. I think the message from this trial is it's one thing to hear from people like me that you need to exercise or reduce stress, but it's another to problem solve, set goals, reflect, and be supported by people who are facing similar challenges. Research shows up to 90% of people with cancer experience fatigue. It's very difficult to point to one mechanism. There are so many things going on. The treatments can be toxic, your body is repairing itself, altered nutrition and sleep cycles, stress and travel, and of course your emotional state can be a major influence on the severity of fatigue. Patients who are older, who have advanced cancer, and who have received more than one type of treatment, such as radiation and chemotherapy, are more likely to have long-term fatigue. One reason that fatigue is undertreated is there is no high-tech test. Western medicine is much better at treating things it can test for.
Having said that, a good way to describe fatigue to your caregivers is to give yourself a score on a scale of 0 to 10, where 0 means you don't feel tired at all, and 10 means the worst tiredness you can imagine.
If you're scoring above 4, you need to discuss this with your caregiver. If you're scoring above 7, you really need to. Another reason for undertreatment, which is interesting, is that people don't bring up their fatigue with their care team, as most believe there's nothing that can be done. So with that in mind, the question is, what is the most effective treatment? Well, it's interesting, is I would say the best treatment for most of fatigue is, well, actually, you. Yeah, sure, you may need to treat your anemia, your thyroid, or the side effects from medications, but even then I think you'll gain strength if you improve your own thoughts, attitudes, and behaviors around fatigue. Looking at the research, my take is that there are two key behaviors that we see in people who manage their fatigue well. So let's start with what I would say the research shows is the number one treatment for fatigue: exercise, activity, walking. Now, this is, of course, counterintuitive. I actually feel weird saying it, as I have this reality check image in my head of you being up all night sick or just coming out of surgery and going, really? And obviously you need to fuse the research with your own reality. But when patients ask, won't that exercise or activity make me more tired? Actually, the research says no. There's significant evidence that a low to moderate intensity exercise program can substantially reduce cancer-related fatigue and improve your quality of life. You're going to have to figure out for yourself what is the amount of exercise that energizes you and what tires you. Most trials start with half an hour a day. You can take your pick: walking, low weights, yoga, cycling, waving your arms in bed, whatever works for you. No specific form of exercise has been found to confer greater benefit than any other. Many patients find it helpful to track their activity with a pedometer or one of these new fancier electronic versions. Also, let's face it, cancer can put that 3 pounds of brain tissue that controls our levels of fear, joy, worry, sadness, and our sense of control through the ringer. And I think walking does a lot for mission control. The second key, and this may be a good life lesson for all of us, is to visualize your energy bank account. Now, many of you will find that your energy account is less with cancer. So you need to look at the things in your life that draw on that account: stressful relationships, worry, pain, sleep problems, and counterbalance these with healthy eating, meaningful work, reframing of setbacks, humor, and peace of mind. It's time to stop and push the reset button. What in my life is needlessly subtracting from my energy account, and what can I do to add to it? To keep the energy account in positive balance, we often talk about the 3 Ps: planning, prioritizing, and pacing. Planning fatigue management around treatments is critical. Almost 100% of people experience fatigue with cancer treatments. But how much you will is hard to know. For radiation and chemotherapy, this fatigue tends to get worse with successive treatments. Fatigue with surgery is so dependent on the type of operation, but most people do get better with time. Expect that it might take 2 to 3 months for fatigue levels to return to normal. For some, the road back to normal can take even longer. Your care team can help you plan for fatigue. Interestingly, research shows that general cancer coping programs aren't nearly as successful as fatigue-specific programs. A large review showed general programs were successful 14% of the time, and fatigue-specific programs 80% of the time. Typically just 3 sessions focusing on education, self-care, coping strategies, and activity management. Many cancer centers offer these programs, so sign up and don't forget to ask other patients. There is a lot of practical wisdom out there. Priority setting is critical. Having cancer can give some clarity to this. Draw a picture of your major commitments, consider where each fits on your list, then talk to the people involved to manage expectations and get a shared vision of what the new plan is. Now is the time to redesign your week around your priorities. Keep it simple: nutritious food, good sleep, good friends, and finding a place where you can visit that brings you peace. Healthy eating is both more important and can be more of a challenge with cancer. Patients often reflect on how they need to be more thoughtful about their nutrition when starting treatment. That making change in their calories, protein, or fiber intake can give them much more energy. Pacing is key, especially for people that are used to being able to go at a high rate all the time. Pacing is linked to priorities, but plan for things to take a little longer. I find pacing can also be about attitude. You're going to walk a fine line here, both with cancer and with fatigue. Being optimistic, but also realistic. Hoping for the best, but preparing for less. Being active, but not overdoing it. This will require special powers from you, I think, in being adaptive, flexible, and giving yourself time to process. All these self-care skills are much improved with a favorable attitude. Easy for me to say, but something to think about. I'll finish by repeating myself. Discuss fatigue with your care team. Discuss it with important people in your life. Don't be scared to ask for help, and maybe more importantly, take it when it is offered. Try to be active, eat healthy, plan and pace. You are the medicine for fatigue. So I hope this helps. Take care.
So, going through that one there, I know it's a very long video, and Dr. Mike Evans, he does speak quite quickly, but a lot of the information in there is quite good. So I do encourage you to go through and find that one on YouTube and have another look through, because I think there's some great information in there. Just touching on some of the things that he was going through, that there are a lot of physical effects from the cancer, and personally going through and providing rehab programs for some leukemia patients this year. These are the main things that have come up for me. So things like your balance, and the medications have a lot to do with that, as you would have been told by your hematologist. Things like nausea, especially when coming down off doses from your prednisone, your steroids, pain as well, and that's not having successive treatments of chemotherapy and radiotherapy can start to bring about pain in certain areas. So low back pain is one of those ones. that seems to come along as well. So it's quite common after successive bouts to have very specific joint and muscle pain. Loss of mobility and flexibility, that's a big one for getting back into active lifestyles. So you may find that you sometimes do things which normally would have been very easy to do, and then you try them again. So I'm thinking something like even as simple as hanging out washing and things like that. And because you've lost maybe a little bit of flexibility through your back, it then knocks you around quite a bit more, and your back's very sore for a couple of days afterwards. Nerve damage, so your peripheral neuropathies, and also weight loss and weight gain, and that's with regards to treatments as well, such as bone marrow transplant, and then on the other side of the coin is some of the steroids that are given as well. So there's a lot. It's not just one problem. It affects the whole body. The treatment that you go through, and then the treatment pathway that you do go through. So it's very important that it's attacked from a multifocal perspective. And this is why it's very important to have a good team around you, and not just health professionals, but also family and friends that are aware of what you're going through and understand, so they can kind of help out when they need to. But this just follows on from that. Some big words in here, but realistically it's just going through and saying that down the bottom, the body will borrow energy from wherever possible if required. So your body wants to do things, you want to do things, but there's a whole range of factors which are maybe holding you back and making it a little bit harder to go about your daily life. So that brings us on to what can we do in terms of, okay, so we're either just about to go through, we're halfway through, or we may have been on the back end of some kind of cancer treatment. And bearing in mind, I'm using some quite broad terminology here because there are a lot of different blood-borne cancers, and there's a lot of different treatment options available, and it affects very different demographics of people, old and young as well. So that's why it is quite broad. Going through, when you look at for myself, and I'm looking at how to program for how to prescribe exercise for different people, you generally you have to go off the research and what works and what is safe. The American College of Sports Medicine is where exercise physiologists generally get most of their information. The thing about blood-borne cancers, though, is that it's not a very highly researched area in terms of exercise prescription, and there's a few reasons for that. One is the reason I said before, that there's just so many broad factors that it's very hard to get a study which you can look at impacting, because you might have a 15-year-old and a 56-year-old and an 80-year-old, all with 3 different types of blood-borne cancers. So it's not easy to get good research on exercise and safe exercise. Something like, and the other side of the coin is you look at something like breast cancer or prostate cancer, which is a little bit more narrow in the field of people that they affect. So there's a lot more research out there for those type of cancers as opposed to the blood-borne cancers. In saying that, we went through, this is a paper from 2010, and these are the major findings: that exercise is effective in improving physical function, quality of life, and cancer-related fatigue. But the programs must be well designed by well-educated and well-informed professionals. And that was basically saying that because there are so many factors and so many things that can be affected by treatment and by the cancer, you really have to make sure that whatever you're giving someone isn't going to do any harm. So and we'll go into some of the exercises that we've gone through for the Fit to Thrive program, but generally we try and keep we keep it very individual. So we do narrow down on the person. There's an extensive informal interview process where we go through and ask about the treatment, what you've gone through, what you've enjoyed in the past. Also, if you do have any musculoskeletal concerns, whether you do have a niggling knee or a back or something like that, which has prevented you in the past from doing some kind of activity. So we have to ask a lot of questions because we need to make it as highly specific as possible, which is what came through in that video too, that an individualised fatigue program is going to actually work a lot better than just a general program. And I think that's one of the big beauties of this Fit to Thrive program, is it does settle the score in terms of it's very hard to program for cancer-specific exercise. However, if you individualise it highly, you get great outcomes. So, going through this, myself as an exercise physiologist is fourth on that list of your team that you need to be around you, and these are the medical professionals that you were saying in that paper needs to be well informed and well educated, because they're the ones that have that have specialist knowledge and specialist roles to help you. And all of them, if you can think about yourself in the middle, with all of these kind of on a bicycle wheel on the outside, coming in as the spokes, all of them adding in to you to give their little bit of expertise to help you along your journey. So, benefits of physical activity. Don't need to spend too much on this because it is in the media quite a bit. So improved quality of life, balance, flexibility, decreased symptoms of fatigue, which we'll go into a little bit later on, improved muscular performance, and your cardiovascular fitness. Going through to start exercising, there's a lot of things you need to take into account because of where you are in your journey. So things like bruising and bleeding, anemia, fracture risk, so bone health. There's a lot of medications which do change how you actually present physiologically, so in terms of your blood pressure and your heart rate. So it's important to that whoever is giving you exercise, so someone like an exercise physiologist is actually trained in identifying these medications and understanding their effect on the body with regards to exercise. So to exercise safely, you have to have a really well thought out, individualised, highly specific plan, and that's only to make sure that there is no harm done. We want to impact on your fatigue, not add to it. So going into a little bit more specifically on this point, these are the normal blood ranges. Some people, depending on where they are, will be going weekly. Some people will be going 6 monthly to get their blood ranges done, depending on what cancer is that they are living with. With these ranges, we constantly. So with the Fit to Thrive program, we had people, every time people came in, we were asking when were your bloods last done, what were they, and made people just be accountable for them, because you need to know these ranges because they will affect how well you can exercise. So going into that a little bit more, if you've got low white blood cells, obviously you're at high risk of infection. So that's one of the reasons why you generally are told to avoid things like swimming pools because of the infection risks. With going to local gyms and things like that, you need to make sure that they're wiped down quite regularly with disinfectant, just in case the guy before you has been coughing up quite a bit. It's something that causes a lot of anxiety, so you don't want to be in an environment like that where you've got sick people, so it's important that you do something so that you do have a sanitised environment. With your low red blood cells, you can generally participate regardless, but you will, low red blood cell count, as many of you would be aware, will impact, it'll add to your fatigue quite a bit, so it will alter your recovery quite a bit, so you need to be aware of that, and it's very individual on how it affects people as well, so you need to establish a baseline of what happens for you. With your low platelets, there's an increased risk of bleeding and bruising, so generally you'd look at generally you'd look at staying away from things where you're gripping quite tightly. So things like hand weights you might stay away from because of that risk, and you might look at some bands, some TheraBands or something like that. But we'll go through. So this is the, we'll get into the nuts and bolts, and I'll try not to make it too full on, but these are the nuts and bolts with the components of a good exercise program. You should have a component of all of these within an exercise program. So things like you should have some kind of flexibility, and you should be aiming with flexibility to get something that's close towards your target areas, rather than just going, all right, well, I need to do shoulders and legs because I was told to do shoulders and legs. It should be, we use quite an extensive flexibility assessment here for our leukemia patients, and then from there we can work out whether you're tight on one side or whether you are tight bilaterally, so that's on both sides for your shoulders but not in your hips, and we'll give you specialist specific flexibility exercises for that for you. With your muscular strength and endurance, fatigue and endurance, they kind of go together, don't they? So when you're prescribing, we try and get people doing a little bit more but less weights, rather than going the high weights, because the high weights has higher instances. If you have things like peripheral neuropathies and things like that, higher weights are generally contraindicated, so you shouldn't do them. But if you can get into those higher rep ranges, and I'll talk about them in the next slide, but if you can get into those higher rep ranges, then you can generally impact your fatigue a little bit more, because you're training the muscles to be able to go a little bit for a little bit longer. And of course cardiovascular conditioning, which is the huge one. If we can keep our heart and lungs quite healthy, we can offset a lot of the secondary complications that you get from going through a cancer treatment. So things like cardiac and lung function. We'll go through. So this is the nuts and bolts of things. CV is it's on the top left-hand corner with your frequencies. This is how many times you should do it in a week. CV is cardiovascular, so something like walking as a cardiovascular exercise 3 to 4 times per week. And then in brackets, it's got a way that you can progress that, so you could possibly progress that to 5 to 7 times per week. With your intensity on for your cardiovascular, this is over the right-hand side, light to moderate on most days. Your time should be, in the video they were saying 30 minutes. Generally 5 times a week for 30 minutes of walking is, for a long time, has been the recommended for healthy individuals, the recommended dose for healthy individuals. You may have to take that back quite a bit. You might have to start with something as simple as just walking up and down your hallway and counting the laps that way, but something as easy as walking, because it is quite a light intensity and it uses many muscle groups, is going to be great for addressing those cardiovascular concerns. So going down, then you've got flexibility with your calf stretch. These are examples. Your strength below that, so one set of 1 to 3 exercises per week. You could progress that to 2 sets, or you could increase the weight, or you could increase the number of times that you do it. B is for balance. Balance and proprioception is quite an important factor for many people who've gone through, are either on something like thalidomide or have gone through a bone marrow transplant, because as many of you would know, you almost have to learn to walk again after you get out of that bed again. So balance becomes quite a big factor, and also a big thing that causes a lot of apprehension for actually doing more activity, because you're not as steady on your feet as you may have been. So going through, this is our outline for our program that the Fit to Fight program goes through. So in week 1 we've got a information session and an initial assessment of 1.5 hours, and this is where we go through and ask all those questions. This is one-on-one. We then give someone a home program based on all that information. And then for the next 2 weeks we do individual review sessions. So that gives everyone a chance to have some good one-on-one time with the clinician, with the exercise physiologist, and then address any issues in the program to make sure that the right mix is there. From that, then through week 4 almost to week 12, you're in a group of 6 and you're coming in twice per week for 1 hour, and that's where you're going through your own individual program with one exercise physiologist having a look over and being there as a bit of a support role. But it's really about kind of setting you up with something which you can do, which you can progress, and then progress safely, and then having trying to build some autonomy with how well you do things. So we take measures at 1, 7 and 12 weeks, and we use that data to actually we will be using that data for some for hopefully to get a paper published, so then people around Australia and around the world can have a look at our program and say, well, okay, we had this many participants across this many ranges of cancer, and we found that this type of program generated these type of results. So we're going to spend a little bit of time having a look at the results now that we went through. This is the first group that we went through way back in February, March this year. In the top graph here we have the different types of cancer that people had, and we had 24 participants going through, and down the bottom we have just the hospitals that they came from, so all around the Greater Brisbane and Sunshine Coast, Gold Coast area. This bar graph's a little bit complicated, but we'll try and make it very easy. Basically, green means an increase, blue means a decrease, and then you can have a look at what, and then across the board, across the top, you've got that 25 number, so that's everyone's individual ones, everyone's count there. So if you look at the left-hand side, muscle strengthening, everyone increased their muscle strength, and we use some objective measures for that, so things like a sit-to-stand test. So we did that for time. Those balance, again, coordination, again, orange is the same. Sleep patterns, it's interesting that most people reported the same. It didn't really impact on their sleep patterns, but we did have a significant amount. I think we had 7 or 8 people report that their sleeping patterns actually improved. Energy levels across the board improved. The feeling of fatigue decreased or remained the same. And this is despite, remember, that you're now doing more activity than you did previously going into the program. So these are people who were, for research purposes, they were sedentary. So they were actually doing more exercise than they were before they went into the program. And despite doing more, they're actually feeling less fatigue. Flexibility increased, and pain levels was quite variable. Some decreased, some increased, some stayed the same. So going through, looking a little bit deeper, all our 24 initial, and actually all of our participants went through a questionnaire that went through some emotional parameters. So most of these people that we went through in the first 25 had an increase in their emotional well-being. And that's not just from the exercise, even though there's great research to say exercise is fantastic for endorphin release and improving self-efficacy and giving that great buzz and happiness feeling. There's a huge social aspect to having 6 people with you twice a week, exercising, doing their own thing, but also linked in with they've either been through their cancer treatment or are currently going through their cancer treatment. Some have kids and are really early in their careers, and some are retired. So it was quite good to it's quite good to actually link in with those social factors which do impact on people's emotional well-being, because you've got 6 people that actually understand, not just say, oh yeah, I understand, these people have actually been through it with you, and they can be a really good emotional support. So into our exercise programming, we've got, with the Fit to Thrive program, we generally look at, from that individual assessment, we'll give you a, your exercise physiologist will stream you, but you won't be told about where you're streamed. But we have different levels within there. So if you come in in the first week and you may have a very sore lower back and knees that hurt, and you're not quite happy walking and that hurts and things like that, and if you sit to stand test and your 6-minute walk test are on the lower end of the scale, you might be looked at as a level 1, and I'll explain these ones as we go through. But a level 1 is just a way that your exercise physiologist can make sure that they've got some kind of plan for, okay, if we start you off at this base level, we can always increase you from there, and we know that this base level is safe and appropriate for you. So it goes through, and we've generally got three levels that we work in, whole body exercises as well as isolated exercises. So we'll go through a few examples of those ones now, just so you can get a feel for how we progress things and give you some ideas as well. So if we look at something like an upper body exercise, or a resisted row, in the left-hand side we've got your level 1, which is a seated row with a band, so very lightweight, where you don't have to hold your whole body weight up. It's isolating through your shoulder girdle, just trying to get those muscles which generally atrophy, that they get weaker very quickly. Going on to the second one, we can then something like this. These are examples, but then similar exercise, but now you're on a cable machine, so you can lift. Obviously, you've increased the load, and increase the load. Going on to your progressed one, you've then got an exercise where you're still doing the same row exercise that's been there the whole way through, but now you're using your legs to hold you up. You're also using your core to keep you in that nice neutral position, so you're not getting thrown around. And this is a little bit more on the functional side of things, but by starting you off on the left-hand side and then slowly progressing you over 12 weeks to get to the top, it's a gradual increase rather than just giving you something which is probably going to do more harm than good. It's a gradual increase, and it's also, you get to the right hand side, you get to those progressed exercises, and you actually get you're able to do more, and you're able to do it better. So functionally, you're a lot more sound because you've gone through a step-by-step process rather than doing something that's a little bit too far. Your second one, so a lower body exercise, for example, a wall slide. So this is just where you're using the weight of the wall and you're slowly sliding down a little way, so not so much to neutral, not to that 90 degrees, and then using your legs to push you back up. The intermediate version of that is to do it without the assistance of a wall, and that's going to be on something like a chair at home. And then your progressed version of that is to do it with a ball, but there you're looking at increasing the load. So he's holding a dumbbell up around his chest. Excuse me. Looking at your abdominal strength, same thing again. We're just changing the planes on this one. So if you look at this is almost at your your vertical, then you're moving down to a 45 degree on the ball, and then down onto a flat. And these are all they're isolated. This is an isolated bridge, so it's what we call an isometric. You're just holding the same position, so not so functional, but it's more for a strength focus. And just because you start on, let's say, level 1 and you do that wall bridge there, your level 2 might actually go on to a different level 2. So you won't just be put on the same pathway. Things change you improve, and there's different factors other than just looking at simply load and making it harder. You can challenge stability and make it single arm and things like that too, which is probably a little bit more functional and closer to your everyday life. And then your last one here is your balance, which is a huge one for us. So we've got something in the left here where you're just holding a weight, and what we can also do is one level before that you do just some single leg stands, maybe holding onto the back of a chair. Your intermediate would be looking at some walking patterning. So we do a few walking drills for people that we identify as having some gait abnormalities that may get benefit from being addressed, and then progressing to putting those two together. So we're actually moving you onto an unstable surface, as well as looking at the gait pattern as well. So with all of that in mind, and I know there's a lot of information to go through there, if you are thinking about starting exercise, and I highly recommend it, because as you can see from the work that we've been doing here with people that are in similar situations to yourself, exercise over 12 weeks and 3 months, as long as it's done safely and progressively, is quite beneficial to many different factors. I would consider your individual circumstances. Some people have been through chemotherapy and radiotherapy and bone marrow transplant, and they may be 5, 6, 7 years post, so they're going to look very different to someone who's only 60 days post bone marrow transplant. So consider your individual circumstances, consult your oncologist or your hematologist before commencing. Make sure that you're aware that this is something that you want to do, and just ask them if there's any precautions that you may want to be aware of. It doesn't hurt to ask, and there's no silly questions. The second point there is that there's an LFQ DVD in production. So this was filmed on the Saturday just gone. This is a version of the Fit to Thrive program, which can be sent out to people in regional areas and metropolitan areas who can't actually get to participate in the Fit to Thrive program. So this has your levels of your exercises going through. It also has a lot of information with myself and Molly Shebel, who's the other exercise physiologist that's been going through with this program for us. It's got some testimonials from those first 24 that went through the program, and it's I haven't seen the end result, but from what we saw on Saturday, it seems like it'll be a very good resource. So look out for that. I'd say it'll be a little bit a while away, but make sure you keep asking around for that, because it is coming along. The last 2 points are more for just adherence. I've found, and I think the leukemia patients who've gone through this Fit to Thrive program, having a program in front of you, some kind of log that says, yep, I'll do this, and ticking things off as they go, it makes it easy to track how you're going with things. So in the video they were talking about things like your pedometers and your Fitbits and things like that. There's a lot of great apps out there, and they're only a Google search away in terms of finding something that's cheap and easy for you for your smartphone to keep track of your walking distances and things like that. And the second thing is for that, just for that support there, get a buddy. If you've got someone who you know who's going through a similar treatment to you, or even a family member who has some time, get them on board, because having someone there is a great little way to keep you honest. It's very easy to start things, but it's a lot harder to keep it going. The last thing is to, of course, enjoy it. Some people just don't like walking, and I can understand that, because I don't like walking. I prefer to swim, and so you've got to find something that you're going to enjoy, but it's still safe. So if Tai Chi is your thing, then that's your thing. Make sure you put in there and you start doing it. If you have previously been at the gym and you enjoy lifting weights, get a nice individualized program that by someone who's able to answer those tough questions like, oh, okay, my hemoglobin's down and has been down for the last 3 months. Does that mean that I can't exercise? And you need to be able to ask those tough questions. And if you've got an exercise professional who doesn't know the answers to that, as I said, there's going to be a lot of people out there who may not have programmed for cancer. You need to make sure you're asking those questions, and if you can't find someone who knows the answer to them, make sure that they're at least reading up and making sure they're doing the right things. So the best I can say is an accredited exercise physiologist is trained in cancer, so they would know or should know at least a really good starting point for what your treatment is, what you're going through, and then how to program around that. So the last little thing is one of my favourite little quotes, and it says that small steps are still steps. So it's as I said before, it's very easy to start something, but you've got to make the commitment to keep going with it. And even if you have those off days where fatigue's higher, and it will be like that, you will have very, very variable days in terms of your fatigue. Something is always going to be better than nothing. So if you can get in and just try one little thing, even if you only do half of what you did the day before, but at least you can turn around and say to yourself, well, yeah, I still did a little bit. It all adds up in the end. There's been a charitable donation that's been afforded to the Leukaemia Foundation. So for the participants, it's free. After the people that have gone through the program have then decided to go and continue doing exercise through Aspire Fitness Rehabilitation. So they have gone through. We do have an extension class afterwards, which is $15 a session for graduates. If you're unable to get into the Fit to Thrive program, bearing in mind that it is expanding, but if you are regional and things like that, usually you can link in with your GP, and they will write you out a chronic disease care plan. And what that gives you is it gives you subsidised sessions with an exercise physiologist. So for us, it takes a $100 consult down to $50, but that will change depending on which rehab centre you're going to and things like that. But for the Fit to Thrive participants, it's actually free. Yes, it's actually currently, it will be rolled out next year. We will be getting a program down there. At this stage, we're still trying to sort out logistics for how that can happen. But I'd urge you to stay in contact with Leukaemia Foundation Queensland, because they'll be the ones who will be able to provide the most up-to-date information on there, because Leukaemia Foundation are the people that will be organising all those details. It will be run by Aspire, so at this stage myself will be going down twice a week to facilitate those sessions for at least the first group going through, and then hopefully training up some EPs down on the Gold Coast to then be able to carry out the program to the same standard and same specifications that it's being done in Brisbane. So I want to thank you for your time, and thank you for having me, and hopefully you've gotten a little bit out of it.